Hi, everyone, and welcome to the Module 5 assignment overview. For this assignment, you will design a health promotion program for a specific clinical setting, such as a primary care clinic, outpatient facility, or community health center. This program should build upon your original project idea and intentionally adapt it from a community, workplace, or school-based context into a clinical environment. The goal of this assignment is to help you apply the principles of health promotion and disease prevention discussed in this module to create a realistic, evidence-informed program plan that could be implemented in a healthcare setting. The first thing you'll do is provide a rationale for your priority health issue. Clearly explain why this health issue is a priority for your selected community and for the clinical setting you've chosen. When adapting from a community or school-based program, think about how the issue presents in clinical practice, such as frequent diagnoses, missed screening opportunities, preventable complications, or health disparities seen among patients. Next, you'll describe health promotion strategies. This is where an adaptation becomes especially important. Community or workplace programs often involve group education or broad outreach, whereas clinical settings require a brief, targeted, and workflow-friendly intervention. Consider how your strategies might shift to include clinical screenings, provider counseling, patient education during visits, referrals, or follow-up support. Be sure you explain how these strategies fit within the time, staffing, and structure of a clinical environment. You'll then identify community resources and partnerships that support your program. Even though your program is now based in a clinical setting, community partnerships remain essential. Think about how the clinic can serve as a gateway, connecting patients to community organizations, support groups, wellness programs, or public health services. Explain how these partnerships enhance the continuity of care, reach, and sustainability. The next section focuses on expected outcomes. When adapting to a clinical setting, outcomes often become more measurable and patient-centered. Short-term outcomes might include improved screening rates, increased referrals, or enhanced patient knowledge. Long-term outcomes may involve improved disease management, reduced risk factors, or improved health outcomes. Make sure that your outcomes clearly align with your revised strategies and setting. Finally, discuss the potential challenges and solutions. Clinical settings face unique barriers, such as limited appointment time, provider workload, and reimbursement issues, or patient compliance. As you adapt your program, think about how these challenges differ from community-based settings and propose realistic, evidence-based solutions, such as using brief interviews or interventions, interprofessional collaboration, patient education tools, or leveraging community referrals. Overall, this assignment is about showing that you can translate a broader health promotion program into a clinically feasible intervention. A strong submission will clearly explain what changed, why those behaviors are necessary, and how the adapted program meets the needs of both patients and providers. If you have questions as you revise your original project for a clinical setting, please reach out early or feel free to join the office hours. I look forward to reviewing your work.